Hi, I'm a urologist and pelvic surgeon. And today we are going to talk about something that affects a lot of people after they have babies, and that is your bladder health after pregnancy. Can having a baby make you pee your pants? Well, the good news is it doesn't have to, but you do have to be proactive about it. So what happens is during pregnancy, your bladder, just like everything else, gets bigger because you're growing a human. And as it gets bigger, the muscles in your body, including your pelvic floor muscles, get stretched out. And so when you're pregnant, you're often, unfortunately, wearing diapers because you can't control your bladder as well as you could before. And after pregnancy, most people get better, but some people don't. And the problem is urinary incontinence, or leaking urine, can really affect your quality of life, your confidence, your relationships, and it can be really, really frustrating. So how do we prevent it, or how can you prevent it after you have your baby? So first of all, you want to start with a good bladder health routine during pregnancy. That means no smoking, no alcohol, and limiting caffeine. And if you do smoke or drink alcohol, you definitely want to cut down or stop completely as you approach your due date. You also want to make sure you're doing your pelvic floor exercises during pregnancy, and those are things like Kegel exercises. I've made videos about this before, so make sure you check those out. But essentially, you want to strengthen your pelvic floor muscles, which are the muscles that hold up your organs, including your bladder. Another thing you can do is make sure you're not constipated, because constipation can actually make your pelvic floor overwork and can worsen your urinary incontinence. So make sure you're getting lots of fiber and fluids and exercising regularly. And after delivery, it's important to continue these good habits. If you've been a diabetic during your pregnancy, you definitely want to keep that in check because poorly controlled diabetes can make urinary incontinence worse. Lastly, if you've had an episiotomy or a vaginal tear, it can sometimes take 6 to 8 weeks for that to heal. And so if you're having urinary leakage because of that, that will get better on its own. But if you're having significant urinary leakage, more than just a couple drops, make sure you see your doctor and talk about it. There are lots of things we can offer you, including physical therapy, which can be very, very helpful, as well as medications and other treatments. And there's no shame in it. This is very, very common after delivery. And most people get better with the right treatment. If you enjoyed this video, please make sure to share it with your friends. And if you have any questions, leave them in the comments below. As always, remember to take care of yourself because you're worth it.